Let's start the today's lecture. Am I audible to everyone? Okay, thank you, thank you. Okay, so as we have discussed in uh, tablet chapter in previous class, in yesterday's class, what is remaining is the part of quality control test and as well as the part of tablet coating defects as well as manufacturing defects, right? So, uh, first, before that, there is a one small topic of compression machine tooling. What is compression machine tooling is? Can you tell me, guys, what is B tooling and D tooling? What are the head diameters and barrel diameters? Can you tell me, guys, what is head diameter and barrel diameter? And what is BB tooling and D tooling? Okay. So in case of B tooling, what you have to remember is that the head diameter is 0.75 inch. Okay. And the barrel diameter, that is I have written is B. Okay. Barrel diameter will be 1 inch in case of BB tooling. So it is about the punch, that is the upper punch and lower punch, as you know. There is upper punch and lower punch in tablet compress press, multi-tablet compressing machine, that is multi-station rotary press, right? So in that the punches are present, right? So in that punches there is a two types of diameter, that is head diameter and barrel diameter. The head diameter in case of BB tooling, and this BB tooling is for the small tablets. BB tooling is in case of the small tablets. So BB tooling is used for the small tablets, and the head diameter in that case, the punches have head diameter of 0.75 and barrel diameter of 1 inch. Okay. While in case of D tooling, in case of D tooling, the punch diameter or head diameter I have written as H. Okay. So the head diameter is 1 inch and the barrel diameter is 1.25 inch. Okay. In some books, in especially in Ledman, they have written it as a 3/4. Okay, 3/4. And here they have written it as uh, I think 3 into 9 by 20, 9 by 16 around, right? But in inches, it is 1.25 and then 1 inch. Okay. So just in a mathematical way, they may it is may given different, but this is what the its actual value. So detooling is for the large tablets. Okay, detooling is for the large tablets. Please kindly mute your mic. Please kindly mute your mic. So detooling is for the generally for the large tablets. Okay, so this is very important concept. Because there is a possibility of asking MCQ from, they may ask the MCQ from the compression machine tooling part. Okay. Please kindly mute your mic. Now we move towards the evaluation of tablet. So can you tell me guys what kind of quality control test we have to perform for the tablet? Which are the main two types? Which are the main two types? Type your answer in chat box. Which are the main two? Yes, official and one more. Yes, official and non-official. Very good. And another synonym for the official test. Another synonym for official test. Another synonym for the official test. In process test, not in process test. Pharmacopoeial and non-pharmacopoeial, right? The official tests are the pharmacopoeial test, and the non-officials are the non-pharmacopoeial test. Official test means it is recommended by the pharmacopoeia that a particular company have to perform that all quality control test according to pharmacopoeia. Okay, for the approval of that tablet product. But in case of non-official test, it depends on the company that whether they want to perform that particular test or not. Okay, so that are the non-official tests. Now, what is important is that from 2007, firstly, the friability test was under the non-official test, right? Firstly, the friability was under the non-official. But then after 2007, friability was covered under the official test. Okay, so this is very important thing because in some books may still it is written that friability is non-official test, but actually now from 2007 friability is included in the official test. Okay, so it is very important. Now in case of non-official test, which are non-pharmacopoeial test, are includes hardness, then appearance, its size, shape. Okay, hardness, its general appearance, size, shape, and color. These are the you can say or you can say a morphological test. Okay, these are non-official, which means its morphology that how its tablet shape, its appearance, its color, its hardness. This all are covered under the morphological test. Okay, so that are the non-official test, right? But the second test, the main test are include the official test. This test particular company has to perform, right, for the approval of the product. That includes dissolution, disintegration, then the assay, okay, assay that is weight variation, and then content uniformity. Content uniformity involves the assay value of the drug that and how much amount is present. It is also important, and its purity also, right? So this all are covered under the official test. Now, the first is a general appearance. So this is not much important, but they are covered under the non-official test. That is very important. Okay. So remember that which are official and which are non-official because there are many MCQs already has been asked on this simple concept that what are pharmacopoeial and what are non-pharmacopoeial test. Now the important one, which is the important one is hardness. Okay. Others are, it's okay that whether companies are going for that test or not, but hardness is very important. Although it's non-official, but hardness of a tablet is very important. Okay. And it is directly correlated to friability. And that's why they have included friability into the official test. Okay. If a friability test, a particular tablet passes the friability test, then definitely its hardness is also would be appropriate, right? Because it passes the friability test. Now, in case of hardness, what is the required hardness? Generally, what will be the hardness of a tablet just taken by the oral route? What will be its hardness in terms of Newton force, or how much force is required to break that tablets? So remember that it's a 5 to 10, right? It is in between 5 to 10 kilonewtons. Okay, 5 to 10 kilonewtons. This is the value that generally the tablets fall in the range of. Okay, 5 to 10. Now we move towards the official test.
నువ్వు స్నానం చేసి మళ్ళీ బకెట్లు పట్టే నీళ్ళు వస్తున్నాయి.
Kindly mute your mic. And before that, these are the hardness testers, right? You all may have read it many times, right? So these are the hardness testers. One is Monsanto, then Pfizer. This is generally used in the academic institutions, right? You may have seen in at your see this at your college. Then Pfizer, then Irvega, Salinizer tester, and Strongwork. Okay, in industries mostly Irvega and Salinizer is generally used. And for academic institutions, the Monsanto is widely used in the at the academic institutions, right? So these are the different hardness testers. Okay, very important to remember the names of these testers, because two, three times the question was also coming from this part. Okay, the name of the hardness testers. Now we move towards the official test. Okay, as I have mentioned in start, that the friability is from the 2007. It's covered under the official test from the 2007. Okay, it's become official. So pharma companies have to perform the friability test also. And what is the general range of the friability? What is the general range of the friability? If a particular tablet have to pass the friability test, what should be the criteria in terms of percentage friability? What should be criteria? Percentage range. Weight loss should be
Than
less
1%.
than 1%. Yes, very good. Yes. So it should be less than 1%. And which instrument is used? In case of friability, it is Roche friabilizer,
Roger
right?
Fabita.
Please kindly mute your mic. It's a Roche friabilizer, right? So this consists of a plastic chamber. And what is important to note is that it rotates at 25 RPM per minute. Okay, 25 RPM. And it's generally performed for a 4 minutes. So in 4 minutes, generally this Roche fibrillator rotate 100 times. Okay. In 1 minute, it's for 25 times. So for 4 minutes, it's 100 times, right? So it's rotate 100 times in 4 minutes. Okay. And as written, it is written here. And one more thing, that its height from where the tablet fall to this from here to here. This height is 6 inches, okay? Where from that height, the tablet fall onto the surface, right? So that height is 6 inches, and the RPMs are 25 RPM, and for 4 minutes it's 100. Instrument is rossifibrillator, and the as I have discussed that it's not should be not more than 1%. Okay. And simply the formula for calculating the friability is the initial weight minus final weight divided by initial weight into 100%, right? So you will get some percentage, and that percentage value should be or must be less than 1% or not more than 1%. Okay, less than 1%. So this is very important to remember. Okay, and remember that friability is now an official test. Okay, and hardness is non-official test. Now we talk about the weight variation test. Okay, so in case of weight variation test, how many tablets we have to take is 20 tablets. Okay, and we have to weigh it individually, and then we have to calculate its average weight and compare that average weight with the individual weight. Okay, we have to first weigh it individually, then we have to take average weight, and we have to compare the individual tablet with the average weight of the tablet, right? And if uh, the limits are generally 80 to 120% and generally 95 to 105%. The actual table for the weight variation is like this. It is in terms of percentage. This is the content. Okay. This is about the content of API and excipient, all includes, right? But in case of the in terms of the weight of the tablet, according to IP, this is for the USB. According to IP, if it is up to 80 mg or less, if it is up to 80 mg or less, what will be the allowed variation in the weight? What is the allowed variation according to IP? Yes, it is 10%. Okay, not 5 VK, it's 10%, right? Plus or minus 10% variation is allowed if it is 80 mg or less. If it is between 80 to mg, then the variation allowed is 7.5%, plus or minus 7.5%. Okay, plus or minus 7.5% variation is allowed. And if the tablet weight is greater than 240 mg, okay, then the variation allowed is plus or minus 5%. As you can see, 2.5%, gradually 2.5% is decreasing. Okay, as the tablet weight increases. Okay, so it is very important to note down. Okay, this is according to the IP. But according to USB, these numbers are somewhat different. Okay, so you all have to remember this also in terms of quality control test. That what are the difference between IP and USB? Okay, and also there we will discuss that in dissolution test. Yeah, according to USB, the tablet weight up to 100 mg or less, the percentage variation allowed is 10%. The weight is somewhat different. The percentage variation is same. Then for 100 to 324 milligrams, I think around. The variation allowed is plus or minus 7.5%. And if it is greater than 324 mg, the variation allowed is plus or minus 5%. Okay. So just weights, the weight of a tablet is somewhat different, but otherwise the percentage variation is same. Okay, so this is very important. You have to know, remember this very important point, because it is different in the according to IP and USP. Okay, and generally they have used to ask the difference between IP and USP. Okay, now we move towards the content uniformity test for the tablets. Okay, now one more important thing, that what are the criteria for the particular uh, you can say, if, whether you have to perform the content uniformity test or not. There are some criterias, that if your tablet weight or your API weight, sorry, not tablet weight, if your API weight or amount, API weight or amount is less than 10%. Okay, less than 10% of the tablet weight. Okay, it means that if the weight of the tablet is 100 mg, and if your content, API content is only 10 mg, or a 10 less than 10 mg, okay, 10 mg or less than 10 mg, then you have to perform the content uniformity test. Okay, again I am repeating, if it is 10%, less 10% or less than 10% of the actual tablet weight, the amount of API is less than 10% or uh, 10% or less than 10% of the actual tablet weight. If it is 100 mg, then the amount is there, so it will be 10 mg if it is 10% API, right? And also same for the, if the weight of the API is less than 25 mg or 25%, this also covered under this also cover under the content uniformity test. For this kind of API also, you have to perform the content uniformity test, right? 25% or 25 mg. Okay, less than that, then also we have to perform the content uniformity test for that API. If the weight of the API is less than 25% of the original tablet weight. Okay, so this is very important. Remember this, note it down. Okay, and if you have any question till, you can ask in the chat box. Now how to perform the this test, right? Content uniformity test. So we have to select 30 tablets, right? But before that, in first step we have to select 10 tablets. Okay, from that 10 tablets, 9 tablets must have, again I am repeating, must have or must need to have the amount or percentage of API around about 85 to 115%. Okay, 115% range. It means that 100 mg, if the API, if the you can say, for example, 10 mg is the actual API weight. So it will be around 8.5, between 8.5 to 8.5 to, what will be the amount? 8.5 to around 11.5, right? 8.5. So the amount of API must be between 8.5 to 11.5 if you take the percentage of the 10 mg, okay? And just set the range. So in that case, it must be between 85 to 115% API must be present in that 9 tablets, okay? And one tablet, if one tablet containing amount of API 75 to 125%, please kindly mute your mic. 75 to 125, then this can be pass. Okay, this test for a particular tablet batch, we can pass this test. But if out of this 10 tablet, if two or more than two are outside this limit, outside this 85 to 115% range, 85 to 115% limit, then this test will be failed. Okay, then the particular batch will fail in the content uniformity test. Okay, if it contain two or more tablets having a outside are outside the range of this 85 to 115%. Now, in this case also, that if 9 tablet contain 85 to 115% and one tablet is in the range of 75 to 125%, then you have to again take 20 tablets. Okay, so now it's total 30 tablets, right? So you again have to take 20 tablets and that and the total will be 30 tablets, right? And now you have to again perform the content uniformity test. You have to add the 20 tablets, right, in that. So you this 20 tablets must be, I'm again repeating, must be in between range of 85 to 115%, right? As one tablet is outside the range, you have to take 20 tablets additional, and then that 20 tablets which you have take additional must be in the range of 85 to 115%. Then and then this test can be passed. Otherwise, if any tablet from this or if any tablet from that 20 tablets is outside the range, then this test will be again fail. Okay, so your particular batch will be fail in the tablet batch will fail in the content uniformity test. Okay, so very important concept. Okay, so total if you see, so then out of 30 tablets, 29 must be in the range of 85 to 115%. Okay, 85 to 115%. Okay, out of 30, 85 to out of 30, 29 must be in the range of 85 to 115%. Okay, and one tablet can be allowed for between the 75 to 1 to 5%. Okay, that is allowed. So then and then this test will be passed. Okay, even if in these 20 tablets, if any tablet is defective, it means it is outside the range of 85 to 115% API content, then also the test will be failed. Okay, any question anyone in this? It is very important. Okay, very important. If you are not able to get, you can rewatch the lecture after it completes, or if you have doubt at this time, you can ask in the chat box. But this is very important. Okay, content uniformity test. Now disintegration test. What are the important things that you have to note down here? Is in case of the disintegration test, first is the number of test tube present in the disintegration apparatus, that is 6 glass test tube. Then what is the its length, which is 3 inches, right? Then what is the mesh size? I think in around 2020, they have asked this question in GPAT 2020, that what is the mesh size of IP. They have asked about for the IP. because this is somewhat different in IP and USB disintegration apparatus. In case of IP, it is around you can say 2 mm, okay, and I think around 8 mesh. And in case of USB, it is 1 point, I think 8 mm or 1.7 mm, and which is in terms of mesh size, it is 10 mesh. Okay, so 10 mesh is for the USB, and for IP it is 8 mesh. Okay, so these are the some important things for the disintegration apparatus. Okay, what is the mesh size? It means that test tube at the bottom of test tube it contain mesh, right? So that size of that mesh is very important. In case of USB it is 10. In case of IP it is 8 mesh. One time in 2020 they have asked the question from this mesh size, right? And then what is the fluid content? That is simulated gastric fluid, which is zero point 0.1 normal HCl. Okay, you must know this also, that what is simulated gastric fluid, that is known as, in short it is known as SGF. Okay, simulated gastric fluid, it means that it's talking about the gastric fluid content in our in human body. Okay, so it is simulated, so it's in general the concentration or normality of the HCl present in the human stomach is zero point 0.1 normal, right? So that's why here also in disintegration apparatus we are using zero point 0.1 normal HCl, right? And what is the temperature of the human body is around 37 degrees. So we are mimicking that all the conditions, okay, inside the which are inside the body. We are trying to mimic it in outside the body, right? 37 degrees Celsius and plus or minus 2 degrees Celsius variation is allowed. Okay, in temperature of your disintegration apparatus. Okay, and the 1 liter beaker is used. Okay, and the cycles which are generally 28 to 32 cycles per minute. It means that the disintegration apparatus contain test tube will move 28 to 32 times up and down into the into your disintegration media. Okay, 28 to 32 times. Okay, and the height will be from the bottom, the height will be 2.5 centimeter. This is also important. Okay, so these are the very important points you have to remember in case of disintegration test. Now we'll go for the dissolution test, and then we'll move towards the tablet coating defects, and then we'll start with the micromeritics chapter and rheology. Okay, we'll start with some MCQs of the micromeritics and rheology. So this is the image of the disintegration apparatus. Now, very important. Can you tell me what is USP, name of the USP apparatus one, and what is the name of IP apparatus one? Dissolution apparatus. What are the different, how many different types of dissolution apparatus are available in IP and USP? How many different types of, how many different types of, yes, it is very important, but how many different types? Yes, seven. Yes, seven. And which one is a type 1 for IP and which one is type 1 for USB? Which one is type 1 for IP and which one is type 1 for USB? Basket USB, yes, pedal IP. Okay, yes, for IP, first one is pedal, right? For the IP, the type 1 for USB apparatus one is basket, right? And for IP, it is pedal apparatus. And for USP, type 2 apparatus is type 2 is pedal, right? And for IP, type 2 is basket. This is type 1, right? This is also type 1 for the USB. Okay, and the second one is pedal. Now, dissolution test is very important for a product for the oral solid dosage form which are given orally. Dissolution to pass dissolution test is very important criteria for them to get market approval, right? And if we apply and a company applies to US FDA for the approval of a generic product, they have to match the dissolution. Okay, they have to match the dissolution with the innovator product, right? Which application is filed for the generic products? Can you tell me which application is filed for the generic products? ANDA. What is the full form of ANDA? Because this question was in the GPAT 2022. Okay. Okay, abbreviated new drug application. Very good. Yes, 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 very good. And what are generic products? What are generic products? What are generic products? Because it is very important for you. They always used to ask the questions on NDA, ANDA, IND. What is this all, right? You will learn it in detail if you pursue your masters in regulatory affairs or in Shootics. If you pursue your masters in Shootics, you definitely come to know about this all in detail. But what is generic product? In general, you must know the basic definition. Bioequivalent to branded. Yes, very good, Shakshi. Very good. Yes. So it's a bioequivalent product to the innovator. And what is bioequivalence? What is bioequivalence? What is bioequivalence? What is bioequivalence? Same bioavailability. Okay, and what is bioavailability then? Same bioavailability, but what is bioavailability? Same bioavailability. I want a definition. What is bioequivalence definition? It's between identical product or a non-identical product. Because simply you cannot say that particular two products are bioequivalent. They must first criteria is that dosage form, dose similar. Yes, route of administration, dosage form, dose similar. And one more important thing is the rate and extent at which it reaches to systemic circulation. It is that is same, right? And also two identical drug products. It means that two products, like for example, paracetamol, right? So paracetamol branded and generic, both are containing 500 mg, and both that branded and generic product are that is innovator. Branded is innovator product, right? So it is reaches to systemic circulation at a same rate and extent. That two paracetamol products are considered as a bioequivalent product. Okay. So that is the rate and extent. Very good, VK. Yes, rate and extent at which it enters into systemic circulation, right? Yes, very good. So now back to the point. So as it is, that's why I'm covering the things which is connected to this chapter also. It will gives you more connection and insight, right? The how this dissolution test important is for the approval. Okay. And generally, it contains 100 ml flask also, and one more is the 900 ml. There are different volumes are present, but generally 900 ml one is most widely used. Okay, because the overall content of our GI, the stomach, right? It is around 900 ml to 1 liter. Okay, so that's why we are using 900 ml. Okay, and the important thing is the it maintained at 37 degree plus or minus only 0.5 degree Celsius variation is allowed. While in case of disintegration, if you have observed, it is plus or minus 2 degree, right? Because somewhat dissolution is somewhat stringent as compared to disintegration, right? Because for the approval, you have to prove your dissolution, right? Now apparatus 2 as we have discussed. And what are the other apparatus, name of the other apparatus? From third one, from the type 3 apparatus, in case of USP and IP, all are same, right? All have a same name. All have same name from the apparatus 3. What is the name of apparatus 3? It will be say as it have same name in the case of IP and USP. Reciprocating cylinder, yes, very good. And what which one is the fourth one? Flow through cell, yes, very good. Then which one is fifth one? Fifth one, pedal or disc, yes. And what which one is sixth? Which one is sixth? Which one is sixth? Rotating cylinder, yes. And seventh, reciprocating holder, yes. And one more name is name of that apparatus is reciprocating disc also, right? Remember that also. Reciprocating holder is also right, and reciprocating disc is also right, right? Now, one more important things which I want to ask you guys that 5, 6, and 7, right? Apparatus 5, 6, and 7 used for the which kind of a dosage form, right? Which kind of dosage form it is used? Apparatus 5, 6, and 7. And what is the yes, semi-solids? Yes, you are right. And but I want to know one specific dosage form which is applied onto the skin. Transdermal, yes, it's a transdermal patches, right? Transdermal patches. For transdermal patches, we use apparatus 5, 6, and 7, right? And one more thing about the USP apparatus 4, that or IP apparatus 4, that is flow through cell, right? What is the importance of flow through cell? In which conditions we use flow through cells, and why we use flow through cells, right? What is the importance of that? It is very important portion, although it's covered under the pre-formulation part. But as it is connecting here, so I am trying to give you all insights of regarding the dissolution because it is very important. There is always mostly question in the NIPER and GPAT on the dissolution because it is very important part of a oral solid dosage form. So that is sync condition. When we have to maintain sync condition, what is sync condition? First, tell me what is sync condition. Whenever we have to maintain the sync conditions, at that time to maintain the not floating. No, sync condition doesn't mean by floating. Anyone, what is sync condition? So for maintaining sync condition, we use flow through cell, right? So for maintaining the sync condition, we use that. Blood flow, no equilibrium. Yes, so you are partially correct. Sync condition is something that when your drug absorb from your stomach, right? So as your blood is in continuous flow, right? So as your blood is in continuous flow, so your drug as your drug absorb from your from the stomach, suddenly it will remove from its absorption side, right? And it will goes into the systemic circulation. So this is known as sync condition. As the a water sink, if you start it continuously, it will flows, right? It will not stop. If you add something in that sink, it will goes with that water. So it is similar in our body. any material which is absorbed. In this term, we are talking about the drugs. So any drug absorbed from the stomach or intestine, it will directly get removed from its site of absorption and it enters into the systemic circulation. Or you can say distributed in systemic circulation. That is known as sink condition. Okay, so for poor soluble drugs, we have to maintain the during the dissolution, we have to maintain the sink condition. So to maintain the sink condition, we generally use flow through cell. Okay, remember this concept. Why we use sink and what is sink condition? Very important and basic concept. You must know that. And the what is the role of flow through cell, right? To maintain the sink condition. Please kindly mute your mic. Now we move towards the tablet coating problems and remedies, right? During the tablet manufacturing, right? And then coating defects and its remedies. And then we'll start with the micromeritics. So these are the general problems. This is caping, as we have discussed this one yesterday in yesterday's class in during the MCQ. We have discussed about the capping and lamination already. Okay. Then chipping, cracking, sticking, picking. Remember this all. Then binding, then mottling, double impression. Then this is okay. It is covered under the poor flow, granule size and size distribution covered under the poor flow, punch variation and hardness variation. Okay, these are very important one, which I have ticked down. These are very important. We'll discuss all in short and what are their solutions, right? Because they are used to ask this question, as we have observed in the yesterday's class, just in GPAT 2023. They have asked the question on the capping, and also the other are problems are also in the option, that is lamination, then the bottling and the other, right? The first one is a problems for the capping and lamination. Okay. So first, can you tell me what are the problems for capping? Why capping occurs? Why capping occurs? First, type your answer in chat box, and then we will see the problems and its remedies. Air entrapment, yes, air entrapment, and one more, one more. Air entrapment, and there is one more. Too many fines, yes, very good, Vivek. Yes, too many fines, yes, one more. There is a 3 to 4 main reasons. One is air entrapment, another one is a too many fines. Then, then high turret speed, right? If your turret speed is much higher, yes, too much diluent. Then if a turret speed is too much higher, if high turret speed is there, then there is also a chances of the capping and lamination as well also. Capping and lamination, mostly they have a same problems of that air entrapment. Then if too many fines are present, then the turret speed is higher. Then there is a sweep of blade, right? When your tablets come out from the after punching, it will come out, right? As the the lower punch will move upwards, your tablet will come out, right? From the punching die, right? So it will removed by the sweep of blade. That is the one blade which removes the compressed tablet, right? So that if the positioning of that sweep of blade is not proper, then also it will lead to the problem of capping or elimination. Okay. So these are the most common problems with the for the capping and lamination. And one more is the drying. If too much drying is too much drying has been is done on the granules, too much drying of the granules, then also it will lead to the capping and lamination problem during the compression, right? So that is very important. And one more is the inappropriate concentration of the binder. If the binder concentration is inappropriate, the binder concentration is inappropriate, right, or insufficient, then also it will lead to the capping and lamination problem. Okay. Then also it will lead to the problem of capping and lamination. Okay. So these are the problems. Now, what are the solution? You just have to solve that problem. It means that the air entrapment is there. So you have to ensure that there is no air entrapment into your in your instrument. So you have to definitely you have to apply the vacuum so that there is no an air entrapment take place in the die wall or any part of the instrument where the compression take place. Right. Then the another one is that you have to do proper drying, that it does not get too much dried, the granules not get too much dried. Then also you have to uh, yeah, use proper binder amount, right? If the binder amount is less, then also it lead to lamination and capping problem. Okay, and also the positioning of sweep of blade, and also the turret speed, higher turret speed is also a reason for that. So you have to optimize your turret speed, right? So as I have mentioned, large amount of fines, then low moisture content, which means that you have added too much, you have dried granules too much, right? Or not thoroughly dried. Sometimes it may happens that properly not it means that granules are not properly dried, right? Partial or complete separation of tablet, right? Yes. Then insufficient amount of binder or improper binder, as I have told. Improper lubricant, this is not in generally observed. These are the main observed problems. Okay, too much dry. Okay, and granule mass too cold to compress form. Okay, if it means that your granules are somewhat at colder temperature, it means that the temperature of the granules are not sufficient to compress them. Sometimes during because of that also capping and lamination take place. Also, you can see here the remedies that you have to remove the fines through the 100 and 200 mesh screen. Obviously, we have to remove the fines. As I have mentioned, the problems, you have to remove that problems. That will be its remedy, right? Then, if the granules are get too much dried, you have to use a moistening agent, right? Moistening agent like sorbitol, PEG, methyl cellulose. These all are hygroscopic in nature, right? What is hygroscopic? Difference between hygroscopic and deliquescent. This was also question in GPAT 2023. They have asked give a definition, and they have asked you the what is whether it will be hygroscopic or a deliquescent, right? Ability to absorb moisture, yes, from environment, that is hygroscopic. And what is deliquescent then? What is deliquescent? What is deliquescent? Yes, because yes, yes. Please kindly mute your mic also, please. So that is convert into the solution. Yes, absorb moisture and dissolve. Yes, that is deliquescent. So this question was in GPAT 2023. They have given the definition of hygroscopic material, somewhat longer definition in a somewhat word play they have done just. They have asked you whether it will be hygroscopic or a deliquescent or a effervescent or a efflorescent, that kind of. Okay, what is efflorescent and effervescent? Difference between effervescent and efflorescent. Okay, type your answer in chat box. We will move towards the next part. Removal of water molecule. Efflorescent. Yes, VK. Very good. Yes, yes. Very good. And what are effervescent? What are effervescent? What are effervescent? What are effervescent? CO2 release. Yes, very good. Effervescent tartric acid, citric acid, NaHCO3. Yes, very good. Very good, VK. Yes, yes, very good. Yes, right. Okay, so this kind of basic definitions also you have to keep in your mind because they are used to ask the questions on this kind of basic topics also, right? In GPAT 2023, as I have give you the example. Now, as we have talked about the capping and lamination, now we talk about somewhat about the picking. As I have discussed, what is picking, right? In yesterday's lecture, and picking is because of the embossing or engraving. What is embossing and engraving is simply a imprint of a company's logo on the tablet, right? And that is due to the embossing or engraving on the punch, right? So this tablet, when on the punch, the embossing is present. So when the punch moves upward, when this punch move upwards, it will pick some mass from the tablet. Okay, it will pick some mass from the tablet. So, and your tablet surface will somewhat exposed to the external environment. Okay, so that is picking, right? So to how to solve the picking? So for that, what is the remedy? Can you tell me what is the remedy for picking? What is the remedy for picking? What is the remedy for picking? Sufficient lubrication. No, there is a one more. You can tell it. Polishing of punches. Yes, polishing with which material? Which material? I want to know the name of the material with which we does the. Yes, very good, Vivek. Yes, we use chromium, right? Very important. We use chromium so that it will not pick up the mass from your tablet. Okay, it will not pick up the mass from your tablet, and for that we have to use the chromium coated or a chromium coated punches. Okay, chromium coated punches we have to use. Okay, we have to use chromium coated punches. Okay, so this is about the picking. Okay, then we talked about the sticking. So what is sticking is that sticking is simply your tablet is get stick to the die wall, right? It will get stick to the die wall. That is sticking. Tablet will get stick to the die wall. Okay, that is known as sticking. And how we can remove it? By adding a anti-adherent. Okay, and what is the example of anti-adherent I have given you in the yesterday's class? What is the example of anti-adherent? Example of anti-adherent, yes, talc is there. One more example, the most widely used anti-adherent. Widely used, no, stearic acid is not an anti-adherent. Stearic acid is a lubricant, not an anti-adherent. Cabosil, yes. Colloidal silica, yes. Athvika, yes. Akshi, very good, very good. Cabosil is its brand name, and the actual name of excipient is colloidal silica. And yes, you are right. Cabosil is its brand name, right? So that is used as an anti-adherent. We have to add anti-adherent so that your tablet will not stick to the die wall. So this is the remedy for the sticking. Okay. Then the mottling. Mottling, as we have discussed in yesterday's class also, that mottling is something that uneven distribution of the color on your tablet. And what is the reason behind mottling? I have told you in yesterday's class. What is the reason behind mottling? Mottling. What is the reason behind mottling? Reason behind mottling? Migration of soluble dye on surface. Yes, very good, very good. Yes, so it's a migration of soluble dye. So when we use solvent soluble dye, this will be the problem of the mottling. So how we can do that? We have to use solvent insoluble dye, or somewhat that the dye have a less solubility in your solvent, right? Because you will apply it in a form of solution. So you mostly dissolve your dye in a particular solvent. So your dye, or you can say disperse or dissolve, right? So you must ensure that your dye is not soluble in that particular or partially soluble in that particular solvent. Okay. So that is its remedy. Okay. For the mottling. And also you have to increase the viscosity. Okay. Also increase the viscosity of the solution, color coating solution. That is also a remedy. Main remedy is to use a solvent insoluble dye. Okay. So that is about the mottling. Then we have talked about the bridging and rate holding. What is bridging and what is rate holding? And what are the through because and what is the reason behind the bridging and rate holding? What is the reason behind the bridging and rate holding? Whatever I am discussing about the tablets till now is very important, because from every part, whatever I have told you in every lecture and in this lecture of tablet also, MCQs, lots of MCQs has been came early already, and it will come for many years. Okay, because these are very important concepts for you to understand. Tell me. Poor flow of granules for rate holding. Yes, very good. Right. So simply a kind of this kind of structure is observed in your hopper. So if this is your hopper, so what happens that on both sides there are granules present here, both sides. But this middle portion where I have drawn this cylindrical structure, this will be hollow, right? There is no granules present. So your granules get stuck around it, and it will form a rate hole like structure, right? A rate hole like structure. And that's why it's known as rate holding. Okay. And if it form a bridge like structure like this, if it form a bridge like structure like this, okay, so your granules will not able to move downwards, right? And what is the remedy for that is to add a which excipient we will add to promote flow, which excipient we will use to promote the flow, which excipient use? Glidant, suitable glidant. Yes, and which one is the most widely used glidant? Which one is the most widely used glidant? Yes, talc is the most widely used glidant. And what is the percentage? Percentage? What is the percentage? What is the percentage? It is 1%, right? 1% talc is used. Okay. So these are the very important tablet manufacturing defects, which are very important to discuss, right? And some we will discuss in the MCQ solving part also. Okay. But these are the important one. In between, I have skipped some slides because they are repetition of the things which I have told you already, and some are the repeated slides. So that's why I have skipped that portion. Okay. We have discussed all the problems and its remedy for the tablet manufacturing. Now we will go for the coating defects. That what are the problems during coating? So for coating, the first and the most important one is the orange peel effect. What is orange peel effect? What is orange peel effect? What is orange peel effect? Inadequate spreading of coating solution. Yes, very good, very good. Yes, yes. Inadequate spreading of coating solution. Okay. Coating solution. Inadequate spreading, right? So inadequate spreading of coating solution, that is known as orange peel effect. Now, what are the reasons behind this orange peel effect? What can be the reason? What can be the reason for the orange peel effect? First one is the higher viscosity of the coating solution, right? Yes, very good. First one is the high viscosity. Okay. First one is the high viscosity. So how we can reduce what is the remedy will be? It will be reduce the viscosity. Okay. So by reducing the viscosity, this problem can be solved. So what we will do is the reducing the viscosity of the coating solution. Okay. Reducing the viscosity of the coating solution. We will reduce the viscosity of coating solution. So that problem will be solved out. Okay. And also that we have to control the atomization rate also. Okay. We also have to control the atomization rate. And one more is the temperature of your drying air. That is also comes under the problem or remedy of the roughness also, right? So what is roughness? Roughness is simply a rough surface, right? Rough surface will observe on your tablet surface. Okay, and for that roughness, why it occurs? Anyone? What is the reason behind roughness? What is the reason behind roughness? Anyone? Anyone? What is the reason behind roughness? Reason behind roughness? Anyone? Anyone? Reason behind roughness? Is the reason behind roughness? First is that your coating solution get dry before it reach to the tablet bead. Okay.
ठीक है ठीक है बता दो नहीं पापा
Before,
बोल रहे थे ना
please
एवढी
kindly
नसते
mute
तर
your mic.
त्यामुळे
Please
एवढे
kindly mute your
सांगायला
mic.
विचारून दिली आहे
Please kindly mute your mic before it reach to
हा काय
bead, right? Tablet bead.
तुम्ही
Before
तेच
it reach
पाहिजे
to tablet bed.
हो काय गाडीने गेली होतं तुमच्या
Please mute your mic before it
होते
reach
ना
to
तुला
tablet
विचारता
bead. It will get dry, right? It will get dry before it reach to the tablet bead. And this is because of the
काल लग्नाला
temperature,
गेलेली ती
high temperature of drying air.
काय
High
हा
temperature
काय
drying air. Okay. High temperature of drying air. So because of the high temperature of the drying air, the roughness problem is occurred. So to reduce solve this problem, what will control is the first one is the
नाही
temperature.
किती बाईकवर चाललं
Okay, temperature of drying air we will control.
त्यांची गाडी काहीतरी खराब झाली काल
Please mute your mic.
काय तिचे पप्पा
Okay, temperature of the drying air.
पप्पाला घेऊन जाऊ का
Please mute your mic.
किती लांब आहे Tuition padav.
Temperature of the drying air we have to reduce. Okay, we have to
Oh,
reduce the
papa.
temperature of the drying air. Okay, we have to reduce the temperature of the drying air.
Ikkadeyana 1 minute.
That can be solved by, so it will solve the roughness problem. Okay, the another problems are the blistering. Blistering, why blistering take place? Why blistering take place on the tablet after coating or during the coating? So it is because of the too rapid evaporation. Okay, so it is too rapid evaporation of solvent. Okay, too rapid evaporation of solvent. This is the reason behind the blistering. And simply blistering means you know that, right? What is blister? It's simply a kind of a swell. Its look is swell. Tablet is get swelled on swelling on the tablet surface. A kind of a blister-like structure is get formed. It is the blistering, right? And it is because of the too rapid evaporation of the solvent. Okay, too rapid evaporation of the solvent. Please kindly mute your mic. Okay, too rapid evaporation of the solvent. This is the reason behind the blistering. Okay. Then there is a problem of picking and sticking here also. But it is somewhat different from the picking and sticking during the tablet manufacturing. Okay. That picking and sticking is different and the picking and sticking in during the coating is different. What is the picking is that when sometimes what happens that two tablets get attached to stick to each other. Okay, two tablets get stick to each other, and when these two tablets detach, when these two tablets detach from each other, so one tablet will pick up the mass from the another tablet. Okay, and this tablet become defective. Okay, and its surface will get you can say exposed. So that is picking. And sticking is simply that two tablets stick to each other. Okay, and why this problem occurs, picking and sticking problem during the coating, is because of the higher concentration. Sorry, not higher, it's lower. It's due to the lower concentration. Lower concentration of plasticizer, right? As we have discussed, what is the function of plasticizer? What is the function of plasticizer? What is the function of plasticizer? Function of plasticizer is to provide the elastiness to the your film, right? To the coating film. Yes, elasticity to the film. So if the concentration of plasticizer is inadequate, what happens that your tablets will stick to each other during the coating, right? During coating. And that sticking, okay, this sticking will lead to the picking problem. Okay. So what we have to do is that change the what we can the remedy is to change the plasticizer, or we can increase the concentration of plasticizer. Okay, increase concentration or change plasticizer. These are the remedies. Then there is a one more problem that is called blooming and dulling. Okay, blooming and dull surface. So this will be observed in case of the polymers, cellulosic polymers. Okay, in case of cellulosic polymers, the problem of blooming. Okay, problem of blooming will observe. What is blooming in simply that your surface of the tablet get uh, bloomed or hazy or a dull surface of the tablet. You will observe. That is the blooming or dull surface or a hazing. Okay, and that is because of the too rapid or you can say too high temperature for the drying. Okay, too high temperature for the drying, and that blooming will specifically observe with the cellulosic polymer. Okay, specifically observe with the cellulosic polymers. Okay, cellulosic polymers, specifically it will observe with cellulosic polymers. Okay, so specifically it will observe with the cellulosic polymers. So it is very important. These are the all about the coating problems and its remedies, and one or two more, that is cratering. Cratering means a volcano-like structure you can observe on the tablet surface, that is cratering. And as the name itself suggests, cratering. So it's a volcano-like structure. Okay. And in case of chipping, chipping is a simply breaking of the tablet edge. That is known as chipping. Simply breaking of the tablet edges. So simply breaking of the tablet edges is known as chipping. Okay. Simply breaking of the tablet edges is known as chipping. Simply breaking of the tablet edges. That is known as chipping. Okay. And one more is pitting. So in case of pitting, it is due to the inappropriate drying. Okay. Tablet inappropriate drying. Okay. So that is pitting. Pitting is simply a kind of your tablet surface will look like this. Right. This is pitting. Okay. So this is pitting. Now we'll move towards some MCQs. And then for 10-15 minutes, we will also look for the micromeritics and rheology chapter. Okay. So we'll start with this question. The question is that in process of adding lubricant to granulation, the lubricant is divided finally by passing it through 16 to 100 mesh nylon cloth onto granulation. In production, this process is called as. Okay, lubricant is passed through the 16 on 100 nylon mesh. What is the answer? What would be the answer? Okay, yes, very good. Yes, it's a bolting, right? It's a bolting. As I have discussed, some processes will, things we will discuss in the MCQs also, right? So that is bolting. So bolting is simply you pass your lubricant from the 100 to 16 to 100 nylon mesh. Okay, that is known as bolting. Okay. Now this MCQ. For oral drug product, a change in concentration of which of the following excipient is more likely to influence the bioavailability of drug? This was the question from GPAT 2021. This was the question from the GPAT 2021. GPAT 2021. Okay. What will be the answer? No, 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 VK. No, 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 it's not right. Vivek, yes, you are right. It's a magnesium stearate. Why? Because magnesium stearate is act as a lubricant. Okay. And if you increase the amount of lubricant, it will decrease the dissolution, right? it will decrease the dissolution. And if the dissolution get decrease, if dissolution get decrease, it will ultimately decrease the absorption. Okay. And as the absorption decreases, what will happen? That it's reduce the bioavailability, right? I'm written is a BA. So it's reduce the bioavailability of the product. Okay, so the answer is magnesium stearate, because if the concentration of magnesium stearate, if you increase or decrease, it will affect the dissolution and ultimately it will affect the bioavailability of the product. Okay. Any question till anyone? Any question till now? Anyone? Okay, so we will move towards the next MCQ. Now, purpose of seal coating in this step of sugar coating is. Now, what are the three different types of coating? Tell me first, what are the three different types of coating? Yes, Vivek, you are right. It is moisture penetration to prevent moisture, sugar coating, film coating, and one more. Which one is one more? Entry coating. Yes. And what are the steps of sugar coating? 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 Steps of sugar coating. Shield, subcoating, syrup coating, and polishing. Yes, Vivek, very good. And in which step the tablet weight build up to 50 to 100%? Weight build up to 50 to 100% in which step? In which step? Yes, subcoating, right? During the subcoating, this thing will take place in sugar coating, right? This step is subcoating, and during the subcoating, it will weight buildup will take place up to 50 to 100%. Okay, 50 to 100% weight buildup will take place. 50 to 100% weight buildup. Okay, so that is good. And in which step we add a coloring agent in sugar coating? Coloring agent in which step? Yes, syrup coating. Very good. Syrup coating is also known as smoothening, right? Smoothening is also a synonym of syrup coating. And one more thing, that for the which excipient used for the seal coating? Which excipient is used for seal coating? Shellac and Jane, right? This question is from the GPAT 2021, and they have in GPAT 2022. What they have asked you is that what is the use of shellac and Jane? Here they have told you the purpose of seal coating, and then they have asked you what is the use of shellac in the sugar coating. Okay, it asked in a different way, but simultaneously 2 years this question has been come. Okay, what is the purpose of seal coating and what are the purpose of using shellac and Zane in the uh, during sugar coating? So it is similar. Answer will be same for the prevention of moisture. Okay. Then this is very important MCQ. What will be the answer of this question? Type your answer in chat box. Okay, fourth. So first, lactose act as a lactose will do a Maillard reaction. This question is from GPAT 2023. Okay, from the GPAT 2023. So it will cause a Maillard reaction. Mannitol, as I have told you, it is shows the negative hit of solution calcium phosphate is contraindicated with tetracycline because it forms a chelate with the tetracycline, right? So tetracycline will not get absorbed. And this spherically dried starch, it is contain 2 to 4% moisture. So A2, then B3, then C4 and D1. So option 4 is correct, right? Yes, very good. Yes, option 4 is correct. Okay. So this is from the GPAT 2023. Now this is the question from the GPAT 2023. That's why I have asked you about the dissolution apparatus type. What will be the answer of this question? What will be the answer? First, okay. Type 1 is whether it will be basket or a pedal. It will be basket, right? Type 5 is pedal over a disc, right? 6 is a cylinder apparatus, and 7 is a reciprocating holder, right? So A will be 2. Okay. A3, then B2, then C4 and the DI. So option 1 is correct, right? Yes, very good, Vivek. Yes, very good, very good. Yes, it's a first option is correct. Okay. Now this is somewhat different MCQ, but this I have added to somewhat touch up the topic of dissolution. Which equation gives dissolution? Yes, it's a Noyce-Whitney equation, right? Noyce-Whitney equation. This question is from the GPAT 2021. Okay, Noyce-Whitney. Yes, very good. And what is the Henderson-Hasenbeck equation is for? Henderson-Hasenbeck equation is for the, yes, V for the pKa, right? If we have to identify the pKa of a drug at a particular pH, what will be the pKa of drug? Then we have to use the Henderson-Hasenbeck equation. Remember Henderson-Hasenbeck equation because every year they are used to ask the question on this Henderson-Hasenbeck equation, and from this equation in NIPER 2023 also they have asked the question. Okay, and what is the fixed first law? What is fixed first law? Diffusion, yes. And what is the Michaelis-Menten equation for? And what is for Michaelis-Menten equation is what for non-linearity. Yes, non-linearity. Yes, very good. Okay, so remember this kind of things. Okay, very important. And now we will move towards the micromeritics and rheology chapter. Okay, where more 10 to 12 minutes I will take, and the next portion of the micromeritics and rheology we will take in the next lecture. Okay. So what will be the answer of this question? We'll start with the MCQ and we'll understand the concept with the MCQs itself. Okay. I will start this chapter, remaining part in chapter in the next lecture. But we will solve the MCQs on and try to understand some concept of this chapter. Okay. What will be the answer of this? Difference in velocity between two planes of a liquid separated interstitial distance is called as. What is the answer? Shearing stress. Are you sure? Are you sure? VK, are you sure it is shearing stress? Because it is talking about the velocity upon distance. Answer 1. Yes, Vivek. Very good. Yes. So it's simply telling you about the velocity upon distance. That is dx by dt. Distance, that is talking about the velocity. And this is a rate, right? So that is the rate of shear. Okay, rate of shear. And shearing stress is the force you are applying. The force which you are applying to move the particular liquid, right? Or a solid. Okay. So that is that force, that is pressure, or pressure you are applying. Force in terms of pressure you are applying, that is the force upon area, that is a shearing stress. Okay, that is shearing stress. Okay, now what will be the answer for this MCQ? What will be the answer? Yes, very good. Yes, yes, very good. So it's a surface area of powder. Kozinski-Karaman equation. And which instrument is used for the measurement of surface area of powder? Which two methods and instruments are used? Which two method and instruments? Which two method and instruments? This is the portion from the micromeritics. Okay, this question is from the micromeritics chapter, and previous one was from the rheology. Air permeability method, and one more, that is adsorption method, right? Fisher subsidizer for the adsorption method. Yes, very good. So this equation will be applied when you use Fisher subsidizer, air permeability method, Kozinski-Karaman equation. And gas adsorption method, that is nitrogen or a helium gas is used. And for that, yes, Quantasor, very good. Yes, so these are the two methods, okay, for the measurement of the surface area. And what will be the surface area to volume ratio? What will be surface area to volume ratio? That is alpha S by alpha V. What will be this the value of this ratio to particle become a spherical particle? What will be the ratio of the surface area to volume? 6. Very good, Sakshi. Yes, it's a 6, right? Remember this kind of things, very basics. You have to remember, right? This all is given in the Alfred Martin book. We will study these chapters from the Alfred Martin books, but I am touching some basic important things and the important concept as we have discussed about the surface area measurement method, right? Air permeability method and gas adsorption method. Okay. Then what are the different method for the density measurement? For the measurement of density, what are the two methods? What are the two methods? What are the two methods? Sinometer, yes. Mercury displacement and gas displacement. Very good, very good. And for which mercury displacement is used, and for which density gas displacement is used? For true density, which displacement technique used? For true density? For true density, which displacement technique we will use? No, 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 no. True density will not be determined by the mercury displacement method. True density will be determined by the gas displacement method. Okay. Will be determined by the gas displacement method. Okay. Will be determined by the gas displacement method. Okay. And which gas we will use is a nitrogen or a helium gas. Okay. And for the granular density, we will obtain true density from the gas displacement method. And for granular density, we will use the mercury displacement method. Okay. For the granular density, we will use mercury displacement method. Very important questions, okay, which I am teaching, which I am asking to you. Okay, and these are very important concepts about the measurement of surface area and measurement of density, that helium cyclometer, helium cyanometer, that is for the true density, and the gas displacement method, that is mercury displacement method for the granular density measurement. Okay. MCQ. This will be the last MCQ for today's class. Rest of the things we will cover in the next class. Last MCQ for today's class. Second, suspension containing high percentage, about 50%. Yes, very good. Very good, very good. Answer is dilatant flow. Okay. What will be the value of N in the dilatant flow? If you know the if you know that equation, what will be the value of N in case of dilatant flow, whether it will be less than 1 or greater than 1? The value of N in the equation of the viscosity when we talk about the dilatant flow, it is greater or lesser? Whether it's greater or lesser? It's lesser, right? VK, it's not greater, it's lesser than 1. N will be less than 1 for the dilatant flow, and for pseudoplastic flow, N will be greater than 1. Okay. Remember that. Okay, and in case of dilatant, this viscosities get increased. So that's why they are known as shear thickening system, right? And in case of pseudoplastic, viscosity will decrease. So that's why they are known as shear thinning system. And this MCQs from this portion, right? Dilatant, pseudoplastic, plastic, many number of MCQ has been asked in previous year GPAT question paper, and this question is from the GPAT 2023. Okay, this is from the GPAT 2023. Okay, so simply if a high percentage of solid is present in your a suspension, that is particularly dilatant flow is observed in the deflocculated suspension. Okay, and flocculated suspension will show which kind of flow? Which kind of flows flocculated suspension will show? Pseudoplastic. No, 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 not pseudoplastic. Not pseudoplastic. No, not Newtonian. Plastic. Yes, it's a plastic flow. Okay, Bingham bodies and the flocculated suspension, they will show the plastic flow. Okay, while deflocculated suspension will show dilatant flow, and pseudoplastic flow will be showed by the polymeric solutions like acacia, tragacanth. Okay, polymeric solutions, acacia, tragacanth, okay, alginate. These all are the polymers, natural polymeric solution, acacia, tragacanth, alginate. This all will show the pseudoplastic flow. Okay, and Newtonian flow, simply the example is glycerol, water, chloroform. These are the example of the Newtonian flow. Okay, so this is for today. Any question, anyone from the content we have covered, and very important content. In last 10-15 minutes, I have told many things about the very important portion of the micromagnetics and rheology. Definitely, we will revise it in the next class. Okay, but these are the some MCQs, and we will see some more MCQs from the micromagnetics and rheology chapter. Okay, we have discussed about the surface area measurement, density measurement, as well as the which kind of flow will shown by the which kind of material. Okay, and we have solved many MCQ for the tablet and also for the micromagnetics and rheology, and tablet chapter is also get completed. So in next lecture, we will start with the micromagnetics rheology remaining portion. We will revise it because the majority, which are the most important topics, I have covered in between in the MCQs, but we will see it from the Alfred Martin book. So you will get some idea about that how to read a Read a reference book, right? What are the how to highlight and what are the highlighted points in the reference book. Okay. So that we will see from in next lecture. Remaining part we will see in next lecture, and then we will start with the UV and the some important portion of the mass spectrometry from the analysis. So if you have any question, you can ask in chat box. Otherwise, thank you for the joining, and thank you for your patientful listening, and thank you for joining. Have a great day. Please tell me example of glidant, anti-adherent, and lubricant for each. Okay. For a glidant, example is talc. Okay. Talc is the most widely used glidant. Okay. Talc is the most widely used glidant. You can also use a carboxyl as a glidant, but generally carboxyl, that is colloidal silica, is used as an anti-adherent. And for lubricant, most widely used one is a magnesium stearate, then stearic acid and calcium stearate. Yes, magnesium stearate is widely used one. Definitely, Sijuka. I will send this PDF to the organizer. I will send this PPT to them. Okay. After completion of next lecture, I will send this. Okay. Some for more MCQs are remaining. So after solving that, I will share this. Okay. Definitely, I will share. Anyone? Any question? Any question? Anyone? Okay. So we will keep it up to here. We will meet in next lecture. Thank you for joining, and thank you for your active listening and your active answering during the session. Have a great day.